All right, we will get started. First, we want to welcome everyone to the Pathways to Wellness Accessing Care webinar series. The Health Council of West Central Florida has designed this webinar series to address the goal of, with the goal of addressing knowledge gaps for all individuals, regardless of insurance status. Today's webinar will feature a presentation all about the KidCare insurance program and how to get coverage for children and families. The chat box will be disabled during the speaker's presentation to avoid any distractions, but we'll enable it again at the end of the meeting to allow for any questions. A disclaimer for our webinar: the views and opinions expressed in this webinar are solely those of the presenters and do not necessarily reflect the official policy or position of the Health Council of West Central Florida. The information in our webinars and e-materials, digital recordings, and other materials like our resource list is for general information and educational purposes only. It should not be construed as an endorsement, recommendation, or promotion of any specific person, company, product, or service. Nothing contained in these materials is or is intended to be construed as advice. We're only providing you with techniques, tools, information, insights, and educational material to assist you in your personal life and navigation of it, accessing care and or health insurance. Our speaker today is Katie Rhodes Turner. Katie Rhodes Turner is the executive director of the Family Healthcare Foundation. They are honored to lead a skilled and experienced team of healthcare navigators who are committed to enrolling Tampa Bay residents into healthcare coverage programs, improving healthcare literacy, and mobilizing community partners. These services are provided to increase equitable access to high-quality healthcare and reduce health disparities in Tampa Bay. Katie has deep end knowledge on pragmatic and fiscal trends in health and human services at the federal, state, and local levels after serving in the public and nonprofit sectors for 15 years. So Katie, thank you so much for joining us today. I will pass it over to you.
Slides. Smart, if you could give me a thumbs up that you can see everything okay? Awesome, thank you. All right, so I'm so honored today to share with everyone an overview on Florida KidCare. Family Healthcare Foundation is a funded Florida KidCare partner. We are KidCare, so we're always so excited to share opportunities for helping families with kids get affordable or no-cost coverage for them. So Florida KidCare is the brand umbrella name for the state of Florida's state-sponsored health insurance for children who are under the age of 19. If anyone's ever heard of the term CHIP, or Children's Health Insurance Program, Florida KidCare is our CHIP. So it actually includes a couple of different programs under the Florida KidCare umbrella. Medicaid, which is providing free health insurance to children for low-income families, and that's jointly funded by state and federal dollars. So that's one component of the Florida KidCare program. As I mentioned, the Children's Health Insurance Program, CHIP, provides low-cost health coverage to children and families that may earn too much to qualify for Medicaid funding. And that is also jointly funded by state and federal dollars as well. And then there's an additional CHIP buy-in program, which is sometimes called the Florida KidCare Full Pay Program. And that allows families who earn more than the subsidized Children's Health Insurance Program to participate in Florida KidCare programming as well. Parents will be paying a premium for that. However, there are still incredibly low out-of-pocket expenses. So as I mentioned, there's a couple of different components under the Florida KidCare umbrella, Florida KidCare being the umbrella brand for the 4 government-sponsored health insurance programs. So Medicaid, so that will be for children in households where their income qualifies them for Medicaid from ages from being newborn, so from birth up until their 19th birthday. For kids whose families may earn a little bit too much to qualify for Medicaid, from ages 1 to 4 may qualify for Medikids. And there's a subsidized or a buy-in or full pay program for Medikids. Florida Healthy Kids will be for kiddos who are ages 5 up until their 19th birthday. And then for children who have complex and special medical needs, there is a separate program called the Children's Medical Services, or CMS plan. And that will be for kids from birth and through up until their 19th birthday, again, with complex or special medical needs. Florida KidCare is a program that offers from checkups to transplants. It is comprehensive and has a wide range of services for children, and it's built for kids. So doctor's visits, primary and specialty are covered, vision and hearing. There's dental care benefits as well. It covers hospital stays, mental health, all immunizations, prescription drugs, and of course, emergency room visits. And Florida KidCare meets the standards of the Affordable Care Act as well. So it covers all pediatric essential health benefits. So it's an incredibly robust plan. And again, even for families who do qualify for the buy-in program, or what's called full pay, the out-of-pocket expenses are incredibly low. So very low co-payments and very low co-insurance. So how does someone qualify for Florida KidCare, any of the programs within Florida KidCare? So they will have to be a resident of the state of Florida. Then beyond that, it will be based on whatever program they qualify for will be based on their household income and their household size. And then finally, also the age of the child will determine which of the Florida KidCare programs they'll be served by. Kids do need to be under the age of 19. And then in addition, a US citizen or a lawfully residing immigrant. And so there is a long list of immigration statuses where as long as they have those statuses, that children can qualify for Florida KidCare. And then also not residing in a public institution. And then again, each of the programs will have different income eligibility requirements. So on the Florida KidCare website, which is newly revamped and looks wonderful, there's a cost calculator, which is a really nice way to kind of just play around and see, what program may you qualify for with Florida KidCare. So it's at floridakidcare.org. It'll ask you 2 simple questions. How many people are in your household? And then what's your annual household income? And it's a great way to see if you qualify for free coverage or subsidized coverage, or if you're going to be offered the CHIP buy-in program or the full pay program. So very easy to use, very user-friendly, right on the website. And what's really wonderful about the Florida KidCare website is that not only is it available in English, it's also available in Spanish, as well as in Haitian Creole. And just a quick little sample of the cost calculator showing that 4 people in a family and having a total income of $45,000 could pay as low as $15 a month for the children that are in the home. So let's say you have 2 adults, 2 children, both of those children combined, the household will only pay $15 per month for their children's coverage. I briefly mentioned the buy-in program for Florida KidCare. So this is going to be the non-subsidized coverage that's available through MediKids, that's ages 1 through 4, or Florida Healthy Kids, 5 up until the 19th birthday. Now, MediKids, again, 1 years old through 4, if there is a buy-in option for families, they're earning too much for the subsidized coverage. It is $248 per month per child, and that is with dental benefits included as well. Now, for Florida Healthy Kids, 5 years old until the 19th birthday, there's 2 options. So $259 per month per child with dental. And then if a family does not want to add dental, maybe they have another option for dental, then it would be $244.50 per child for Florida KidCare buy-in. So this is a really nice option for from our perspective, what we've seen, a really nice option for people who perhaps do not have an offer of employer-sponsored insurance. So maybe someone's a small business owner, or if the cost to insure a dependent on employer-sponsored insurance is too expensive. We see a lot of families who are part of the buy-in or full pay program look at Florida KidCare as a really wonderful, more affordable option for them. Families apply. So enrollment is year-round with Florida KidCare. There is no enrollment period, which is wonderful. So they can apply 365. There is an online application, and we'll take a look at the Florida KidCare website in just a little bit. So online at floridakidcare.org. Families, if they prefer a copy of paper, a paper copy for application, they can print it themselves offline as well from that same website, floridakidcare.org. Applications are also able to be submitted by fax if that's preferred, in addition to that online application. And then if necessary, families can call Florida KidCare and they can ask to have a paper application mailed to them as well. So there's multiple different methods for people to be able to apply for Florida KidCare. So beyond the application and the medical benefits and the dental benefits, there's a quarterly newsletter that's distributed to all of the Florida KidCare families with wonderful resources, relevant tips, many health trends that are seen. And it's a great resource to really get things, especially for the new year, starting the new year off right. So that's a wonderful benefit and resource that families receive. Now, for community partners, if there's a community partner, if there's a school, if there are food banks, if there are other nonprofits or social service agencies that are interested in working or distributing information about Florida KidCare, there are tons of free resources that Florida Healthy Kids will provide at the website healthykids.org. So community partners are able to have free material about Florida KidCare to distribute to families. There's some promotional items as well that can be for free. And every year there are mini grant opportunities as well to partner with Florida KidCare to help promote this wonderful resource that gives children access to healthcare services. And here's some examples on the screen as well. And again, these are always going to be available in English, Spanish, and Creole. So it's nice. We can meet families who have multiple different language needs. So Florida KidCare can be contacted in a couple of different ways. You know, the website is wonderful. We're going to look at that in just a minute. Families can always call Florida KidCare as well. And there's multiple different languages that they're able to speak in and to. Florida KidCare has a Twitter account. They have an Instagram account. They're always sharing wonderful tips. And I'm constantly on my phone, so I'm usually on social media, and they're always posting wonderful resources that myself as a parent, I really appreciate. So as I mentioned that we are a Florida KidCare funded partner, and we are. So Family Healthcare Foundation is a nonprofit, and we help people navigate affordable healthcare options across Hillsborough, Pasco, Pinellas, and Polk counties. And so we will screen individuals, adults, children, families for any affordable healthcare option, whether it be no cost or low cost, and then help them identify ways to apply for that and then remove barriers meaning helping them upload documents, understanding letters, getting them connected to the doctor to make that first visit. And so we are able to help people apply for Florida KidCare, help them understand how to utilize that coverage, how to find a pediatrician. So if you're in the Tampa Bay area, Hillsborough, Pasco, Pinellas, and Polk, and you or someone you know would benefit from looking at Florida KidCare as an option for their children, we would love to be a part of that conversation and help people apply for that program. The best way to reach us is either via our phone number, 813-995-7005, or people can go on our website and make an appointment to speak with any of our navigator team, and we'll always review all options for coverage. And here's some of the contact information directly for Florida KidCare. Again, the website we're going to check out in just a second. And then they've got their toll-free number as well which is open Monday through Friday, 7:30 to 7 p.m. All right, so I'm going to go ahead. I'm going to stop sharing for just a moment. I'm going to pull up the Florida KidCare website. Okay, and so this is super wonderful to share. So this is that cost calculator that we had talked about a little earlier on. So it's a really nice way. If I'm, I'm a parent, and maybe I just got a notice that my job-based coverage is increasing for dependents, and I want to see like what else is out there for my kiddos. All right, so let's say a number of people in my home, and myself and my spouse were making $58,000 a year between the two of us. So it'll ask you to send some of your contact information over, which is really nice because then you will continue to get updates from Florida KidCare about any options or resources that you may have, or that they may have that would benefit you. And then it shows the possible costs for you on Florida KidCare. And so based on the information I just popped in, it said that Florida KidCare would probably be about $20 a month for myself and my family. And then it shows how you can apply right now. And then if you needed to get additional assistance, it'll connect you to ways that you can get assistance for yourself when filling out the application. Something else I wanted to show is there is on the Florida KidCare website as well a way to see what the out-of-pocket expenses would be for any of the medical services that your child may need to access while being a Florida KidCare family. So there's a lot of wonderful information on the website that really showcases all of the amazing services that the programs provide. It also reviews a lot of the information we went over today about how all of the programs fit into Florida KidCare. So I think it's a great resource. Finally, I wanted to share just a quick note about some updates that may be coming soon. There was an exciting approval for an increase to the subsidized coverage for Florida KidCare for Florida families. That is still expected to come. So that might be something we see in summer 2024, but stay tuned because that is going to be coming soon, and hopefully we'll be able to share more information about that in the future.
Katie, I had one question.
Yeah.
With regard to the non-full pay or full price options that are there asset limits in addition to the income?
No, there's not. That's a really great question. So there will not be an asset review but for any of the Florida KidCare programs. So assets are not taken into account. It's really just the modified adjusted gross income for the family. I would encourage everyone to maybe look at like their past tax returns, if that's going to be something that's pretty consistent for the future. So but no asset requirements. That's a very good question.
So if any of our participants have questions, you can type them into the Q&A section along the bottom of your screen there. So we'll give a few minutes to see if anybody has anything else they would like to ask.
I know the chat box is also available too.
And again, if there are any and any of the attendees are representing organizations that would like to promote Florida KidCare, I'm going to quickly go to the Florida Healthy Kids website because they will send information over for free. What's really wonderful, especially during seasons where we see a lot of activity as far as health fairs or resource fairs, especially the back to school season, there's tons of support that Florida Healthy Kids will provide to community partners. So let me grab that really quick under there. Yeah, this is nice. So here, you can just go straight to their website. And it'll show you all the different brochures. And then I think down here, oh, marketing, maybe marketing materials right here. So there's an online order form. That's super nice, but there's wonderful promos that can be given out, and just to families, of course, who may be interested to learn more about Florida KidCare, and all of this can be free too. So which is wonderful, because if you're a community nonprofit or social service agency that are serving families, and you really want to distribute this information because you know that they need it, this is a great, easy way to put that information out there.
We do have a comment in the chat, and it says, great presentation. Please, any specific date on when to expect the awaiting news by summer?
I wish I had that. Unfortunately, and for those, there was in the previous Florida legislative session, there was that increase up to 300% of the federal poverty level for the subsidized Florida KidCare. The premium tiers were shared. It was looking so promising. We knew that more families who earned a little bit too much for the subsidized coverage were going to get a lot of relief. So there's a lot of excitement that is being held up, unfortunately, with implementation. So there was the expected January 1st, 2024 start date. Initially, I think the projection was June, hopefully, as an estimated time, but it may just take a little bit longer. It is coming. We know that it's coming, and we know that it's needed, and we know that families are excited, and we know that service providers are excited for more families to get access to coverage, and that it will allow a lot more kids to get access to affordable healthcare coverage too. So hopefully we'll have some news on that soon. That's a good question. It's the question that everyone wants to know the answer to.
And we'll be happy to try to spread the word when that happens. So just let us know.
Absolutely.
I don't see any other questions or comments. Ismary, I guess I'll turn it over to you.
Yes. Oh, I will just share our upcoming dates, our upcoming webinars. Obviously, thank you to everyone who attended. We are sponsored by Advent Health, and so you will receive a Grubhub voucher to the email that you registered with, probably within the next week or so. And so just look out for that. And then if you have not registered for our next upcoming webinars in March, we have Uninsured, We Got Your Back. It's going to feature a panel discussion amongst multiple counties. And we will just highlight resources and services available to uninsured individuals. And then our June 7th webinar will feature the SHINE program. We will have a representative speak on that, and then it'll be from 12 to 1 p.m. The panel discussion will be a little bit longer, as right now we have 5 panelists, so stay tuned for that. And if you have already registered, you will get that invitation, but if you didn't check these upcoming dates, then it'll be available as well in the same link that you registered for this one. So thank you all so much for attending. And then I know on Monday, you will get an automated follow-up email from Zoom, and it'll feature some additional links and information, and also more about the upcoming sessions.
We did just get a question in webinar chat.
Yes, I will read that one out. So we have a question. I have a family who has 3 children. However, only 2 qualified for Medicaid. Will I be able to apply for just the one child for FKC? I know I will have to add the entire household income, the other children, but is there something that I can click to state I don't want to apply for the other 2?
So they'll check when you apply. And there should be an option in the application that says, who are you applying for coverage for? But there always will be a check for all the kids when you apply to see, if they're covered by Medicaid. Because there's no way to be double covered. You can't have Medicaid and a subsidized KidCare plan. I'd be curious as to only why 2 of the 3 qualified for Medicaid. Because if the income of the household allows for 2 of the children to qualify, what was the issue? And I'm wondering if there might be varying immigration statuses between the 2 children and the one, or and if that's the case, maybe the country of origin, because we've seen that frequently. And I will put my email in the chat if you want to talk more. I'd be happy to. We have seen that. So there may just be some additional escalation of maybe getting that child correctly into the right program. But doing the Florida KidCare application would not hurt. Yeah, I'd be happy to chat. If you want to reach out, we can definitely talk about that. We see that pretty frequently, and it does sometimes take a little bit of additional troubleshooting. But if 2 of the kids qualify, the 3rd likely should have as well.
Yeah.
That's
she
a great
mentioned
question.
The entire family's eligible for SNAP. That's why I didn't understand.
Yeah, it might just be something that can be resolved.
All right. Thank you. We will, I don't know if there's any more questions or comments.
Thank you for the opportunity. This is wonderful. Thank you everyone for participating and joining.
Yes, thank you, Katie, and thanks to Advent Health for their sponsorship, and we appreciate it and hope you'll join us for future events. Thank you.
All right. Thank you. Have a great rest of your Friday.